Good evening, everybody. Good evening. Oh, I love the response. My name is Mariana Tiebet, and I'm the CEO and president of Vital Strategies. And I want to welcome everyone to our first Vital Talks Live of 2025. Yes, countering criminalization with public health vision. My first 4 months of Vital Strategies have really reinforced my belief in the power of public health to shape all of our futures. And at Vital Strategies, our mission is simple: to reduce the global burden of chronic disease and injuries so that people everywhere can live their healthiest and most vital lives. Every day, our team of over 400 people across 80 countries, working alongside government and local organizations, using data to turn it from evidence into policy and practices and people towards sustainable progress in global health. In this evening's discussion, we'll take a deeper dive into the work that our teams are doing to counter criminalization, specifically through our overdose prevention program here in the United States. This work is led by Daliah Heller and Adam Kaparti, supported by our incredible partners at Bloomberg Philanthropies, and also made possible by such an incredible and talented team across many states in the United States. All of us here at Vital Strategies believe that the overdose crisis needs to be met with a unified, compassionate response that prioritizes health and centers harm reduction. A response where punitive measures are replaced with supportive interventions so that every individual at risk receives the care and support that they need to thrive. And where support is offered in ways that respect individual choice and agency. And where we meet people where they are, avoiding the negative and often discriminative impact of measures that criminalize drug use and cast stigma and shame on drug users. And we're in 2025, we can't stop now. The public health community and advocates have made, all of you, have made tremendous progress, shifting the focus on drug use away from criminalization and an approach that supports human dignity. And we've seen that this strategy works. In the 12-month period ending in July 2024, we saw overdose deaths in the United States decrease by 14%. But we all know that there's still too many, almost 100,000 a year of preventable deaths. And we also know that these deaths are still rising. They're not decreasing, they're still rising in Black and American Indian communities across the country. Right now, if you're an older Black man, you are at 4 times greater risk of dying of an overdose than other older men. And so our work is not done. I think we are all acutely aware of the headwinds we face, the rising currents and platforms that are undermining the very bedrock of our work, data and science, and that are eroding public trust and support. It will be a daunting task, but public health has been put to the test before, and I know we're all up for the challenge. And we are lucky not to be alone in navigating this uncertain future. It's an honor to be here surrounded tonight by all of you, our incredible partners, a strong network of advocates, both here and across the world. And I remain excited and optimistic about all of our futures. I think together we do have the power to reimagine public health and to save and improve even more lives. So thank you so much for joining us. I will now hand over to Daliah, who will help lead the panel. And I know we will all not just learn, but be inspired by the discussion tonight. Thank you, Daliah.
Thank you very much, Marianne. So just to sort of set the stage a little bit, I'm going to run us through some sort of background of where we are. We called this talk countering criminalization with public health vision. And as Marianne said, we can contextualize that with overdose prevention. But specifically this evening, I would say we're here to talk about a set of issues: homelessness, mental health needs, and drug use, that are coming together and visibilizing these social problems in public, and highlighting some very acute needs that people are experiencing, and creating a sense of disorder in our communities. This is happening in cities and towns across the country, and it's demanding an effective policy response. Everyone deserves to be safe in our communities, including the people who are experiencing these precarious situations. So we're going to talk this evening about the narrative pushing criminalization as a policy solution to these social problems, and how we can counter that with a vision for public health and safety. So just to begin, homelessness. Let's talk about the data for a minute. So we've heard just in the past couple of weeks, we heard the new data released about homelessness in 2024 from HUD. We saw an 18% increase in homelessness in the country in 2024. And that's after a 12% increase in homelessness being reported from 2023. So significant increases, and while we know that some of that is due to the influx of migrants to many cities around the country, we also know that there has been a steady rise in unsheltered homelessness over the past now more than 5 years in the country that continued to climb even faster with COVID. We know that racial disparities are extremely high among people who are unhoused, and 1 in 5 unhoused people is 55 years or older. Mental health distress is up, and more than ever since the COVID pandemic, we heard about this in the wake of COVID. And this is pushing people who are already vulnerable to the edge, as I'm sure we're all aware. 1/4 of adults, we could say, are now experiencing a mental illness, and suicide rates are rising. And we know that more than 1 in 5 people experiencing homelessness is living with a serious mental health condition. And while people with serious mental health conditions account for only 5% of the general population, they account for 20% of the jail population. I know you've maybe heard that said before, that the jails are the largest mental health care providers in our country, not mental health care providers. But we know also that only half of people with mental illness actually receive specialty treatment in the past year, and that racial and economic disparities are exacerbated by disproportionately low rates of access to mental health treatment. Third, drug overdose. As Marianne said, it's an issue we work on every day here at Vital Strategies, and it remains at historically high levels in the country, driven by fentanyl and the unregulated drug supply, which I know we all know inside out now. We know the word fentanyl. But we know that there's been this decline, and we see this happening in the data from over the past year or through July 2024. And we believe that that's an indication that harm reduction strategies are working. People are aware that fentanyl is widespread in the drug supply, and they're changing their drug use accordingly, including testing their drugs before they use them, using less of those drugs, making sure they have naloxone on hand, and using it when necessary. But we also know, as Marianne said, that racial disparities in overdose have continued to increase dramatically while we see this overall decline, and that homelessness remains a major risk factor for overdose. So all of these issues together, homelessness, mental health needs, and drug use, are showing up in public in a very particular way. And a term that's been used to describe this is public disorder, which actually, if you dig in a little bit, is a policing term, really, because it refers to counter, which is order, maintaining order, order maintenance. As of last June, the Supreme Court decided that homelessness is actually a crime. You probably heard of, or maybe you haven't heard of, the Grants Pass case, which established that people who are homeless can be arrested and fined for sleeping outside even when they have no safe alternative. Drug use is still a crime everywhere in the country, as it was recriminalized in Oregon on the 2023 ballot and even re-felonized in California on the 2024 ballot. But incarceration is still one of the greatest risk factors for overdose. And a growing number of states are enacting legislation to expand the use of forced treatment for both mental health and even for drug use. In 2018, Massachusetts passed legislation to allow involuntary commitment for substance use disorders. And actually, data just came out this past fall from the state of Massachusetts reporting on the relationship between overdose and folks who had been committed under the involuntary commitment law, showing that actually people who had been involuntary committed after the release were at greater risk for non-fatal and fatal overdose in comparison with folks who were released from voluntary treatment. Here in New York, as the new year began, you've probably heard Governor Hochul has announced her intention to introduce legislation to expand the definition of mental health issues that could qualify involuntary commitment for somebody experiencing a mental health crisis. To be clear, we already have a law on the books that allows for involuntary commitment of somebody who's either experiencing a mental health crisis and posing a serious threat to themselves or others. So there's no need for expansion, and we've seen what institutionalization does. It's a story that we worked our way out of in the last century. And more, in many places, we're seeing harm reduction services blamed when we know that people who participate in harm reduction services are actually 5 times more likely to enter into drug treatment voluntarily of their own accord. And we know that many people who are using in public are homeless and they have nowhere safe to go, and that the drugs are potent and short-acting, thank you fentanyl, and that there are still only 2 supervised consumption sites or overdose prevention centers operating in the country. So all of this begs the critical questions we're here to consider tonight. Why are we choosing criminalization as a response to our health and social problems? And what will it take for us to share and spread a public health vision to counter this? It's an intersectoral problem and needs to be addressed that way. And it's a narrative problem, which means we need to talk about what's happening because that narrative is driving policy, which is why I'm pleased this evening to be joined by these 3 fantastic women and to have this conversation with them and with all of you. So I will take my seat. Thank you, Marisol Bello, Executive Director of the Housing Narrative Lab, Insha Rahman, Vice President of Advocacy and Partnerships at Vera Institute and Director of Vera Action, and Chrissie Juliano, Executive Director of Big Cities Health Coalition. Thank you all for joining me this evening. So Marisol, let's begin with you. You're a communications expert with a background in journalism. So can you tell us a little bit about the relationship between narrative and policy and how it works?
Super. First, thank you. I'm excited to be here with all of you today, so really appreciate the time. You kicked us off so well, Daliah, because you said narrative is driving policy, right? The work that we are doing is about advancing a narrative that people have what they need to thrive, to be healthy, to live their best lives. And to do that, the best way that the thing that we need is to get people to buy in, right? To buy in so that we can have public support, public policies, and public investment. Story is the best way that we can start to get that public support, public policy, and public investment. And I'll just kind of back up for a minute to talk a little bit about narrative and then connect it to the issue of policy. Story is everywhere, and narratives are everywhere. Narratives are the collection of stories that really shape how we think and feel about an issue. And they are everywhere. You go to the grocery store, you go to Trader Joe's, you go to church, you have a conversation with a relative, narratives, and they influence all of us. And we as humans are not just influenced by narratives, we're actually defined by narratives. So think about who you are and why you are that way, and there will be stories behind all of that. And so for us then, it means that when we are trying to connect with folks, we have to talk with them about stories that are based on values, right? What are the things that people care about? What, is it their home? Is it their loved ones? Is it wealth, right? I mean, it could be a variety of things. I work in housing, and that idea of building wealth and your home as wealth is a point of connection for a lot of people, and it's a way to be able to talk to folks. And so for us, because narratives are so foundational to who we are as people. They're also enduring, right? I mean, think about narratives about the founding fathers, right? I mean, they're ideals of freedom and liberty, and yet they owned people. How's that for an enduring narrative? Think about David and Goliath. That's 3,000 years ago. Enduring narrative about the underdog. So that tells you something about the power of story and the power of narrative. And for us, as we're thinking about how do we build public support, public policy, and have public investment, how do we harness the power of stories? And the last thing that I'll add to that is that the piece for us, what that means is thinking about how we're going to talk with folks in ways that they're going to understand, and not just the values, but also language, right? And I know people are like, it's wordsmithing, et cetera, and it's like, yes, and because sometimes when we get really convoluted and bureaucratic and wonky, folks are just not, they're not gonna work with us, right? They're not gonna understand. And I think that's where we're right now. That's a narrative tension point that we're missing, and it really provides an opening for those that are posing all of the work that all of you and all of us are doing, to be able to create those kinds of wedges. And that's how we end up seeing policies that are really harmful. I actually would like to just add one more thing about actually an example of how these kind of policies show up. In the last day or two, there was a new state senator, state legislator in Oklahoma that has introduced a bill not to allow any city with a population of under 300,000 people to have a homeless shelter. Like, let that sink in for a second. Any city under 300,000 people in the state of Oklahoma can't have a shelter for people without homes. And guess what? The two places that do have people that have a population of over 300,000, Oklahoma City and Tulsa, where most people of color and brown and black people live. So that's an example of how a harmful narrative can directly influence policy.
Thank you. Yeah, and Marisol just mentioned that story to me before we came in here. We're in for a lot. So Insha, then let's talk about crime and the criminal legal system. I know you've been working around the criminal legal system for decades now, and and thank you for your work. And how does language affect our thinking about crime and safety, and how's it showing up in these issues? And is crime going up?
Well, you said narrative drives policy and also dictates beliefs. And so I'm here, and my contribution is I have worked for years in and around the criminal legal system as a public defender for years up in the Bronx. Saw a lot of people come through the system, and I would say not a single person who had mental illness, who had drug addiction, who was dealing with instability was made better because of jail or prison. It's just simply not a solution to prevent and break the cycle of crime, but it is a response that we have gone to time and time again because we have false narratives about what incentivizes people and behavior, and we have false narratives about who, quote unquote, the villains are in our society that drive crime. And for the criminal justice reform field, I mean, we, from about 2015 to 2020, we were winning. And we were winning on justice reform, decarceration policies that simply put fewer people behind bars, on public health strategies, drug policy, behavioral health policy, and then also just a different idea and a different conception of what actually works to prevent crime, respond to crisis, and stop violence in our communities, and that it's not necessarily more arrests, more prosecution, more jail and prison. Like, we were very, very successful. And what we saw is, first of all, more freedom in this country. Literally, the jail and prison population in this country from 2010 to 2020 dropped by almost 20%. The racial disparities in incarceration, got a little less disparate. Again, we saw huge investments, both as a matter of policy, as a matter of money, as a matter of beliefs, that we can do safety differently. But the challenge was, as we were winning, we weren't talking about how safety and justice go hand in hand. And so we were talking a lot about justice. For those of us who are from New York, we all remember the story of Kalief Browder, and that incredible picture, visual narrative matters a ton too, of this young man who spent 3 years behind bars at Rikers Island, and when he was released, just so broken, so struggling with mental health that he took his own life. And like, those are the kinds of narratives that inspire us to do the right thing. But when we don't bring people along and change their beliefs that safety and justice actually go hand in hand, they are not in tension with each other, when we don't do that, we face backlash. And we are just in a moment of tremendous backlash, especially in big cities where there is this just belief. And it's not just among folks who you think are sort of right-leaning or conservative, but it is widespread among people who would say, I'm a progressive. But how many times have we all had that conversation recently at, dinner party with our families? I'm a liberal, but I voted for Kamala Harris. But like, you just hear it time and time again, because we have to tell a story that we can make reform happen, we can have forward momentum and progress, and we bring along safety as well. And so for us, the backlash of, rollbacks to bail reform, rollbacks to drug policy, rollbacks to efforts on parole justice, and so on and so forth, just had us being like, what are we missing on the narrative? And so about 3 years ago, we actually started just doing a whole bunch of public opinion research to better understand where Americans across the political spectrum are on the issues of crime, disorder, what makes us safe. And what we found is actually really heartening. First of all the policies that we are talking about, that all of us work on, across the political spectrum, people are very supportive of it. Among conservatives in Wisconsin, you know what their biggest crime concern is? Drug overdoses. The fact that there is an economic opportunity and that is driving crime. Those are all things that we actually know the answers to. But if we're not talking about them, and I would say what progressives and reformers we did not do as we worked on great policy reform, is actually tell a story about who the villains are, which is disinvestment, ignoring the root causes of what drives homelessness, what drives poverty, what drives crime, and only sort of telling stories in reaction or response when the narrative is already decided for us. So turns out we actually do have people with us when it comes to policy. We just need to know the messages that work to come out on the affirmative, so get off the opposition's narrative playing field and get on to our own, and own safety, own accountability, own justice. And so what we have seen is, crime actually did go up in 2020. And I think it is a mistake to deny that or to downplay it, which a lot of us did, where we said, but it's not as bad as the 1990s. And that doesn't help anybody, right? So when homicides went up 29% in 1 year from 2020 to 2021, like, the lesson learned is us as people who want to see progress and reform, we should have been leading with that, to be like, this is a huge problem. Every single one of us deserve to be safe, and to tell the story about what is driving that increase in homicides, in assaults, in crime in general, and not let it be that reform has led to lawlessness and to people disregarding the law. But in fact, what else happened in 2020? A global pandemic that literally sort of like ripped apart the social fabric and protective factors like families being together, like access to treatment, schools, after-school programs, employment, everything that actually works to prevent and break the cycle of crime. And so we have, after now almost 30 rounds of national, state-specific, post-election research, really tried to develop a framework for how do we talk about crime and get out from the crime tough or soft on crime debate, which is a loser because crime is the thing that people don't want. How do you flip the frame to talking about safety? And we own it. And safety is about preventing crime, responding to crisis, and stopping violence. And again, that doesn't code as left or right. That just codes as like, oh, I can get behind that. Everybody can get behind that. And then with that, you lead with your values. You name very clearly the villain. I think we are often afraid to say, look, that tough on crime rhetoric, that tough on crime policy, that's actually the villain. We've done this for decades and it has not worked. Let's talk about what does. And then you turn to your vision. What are you going to do about it? And I'll say a thing about data is overall, crime is generally going down, especially in big cities. New York City is the one aberration. There's some funny things going on here. We can get into that more. But in general, the story is across the country, since 2022, crime has gone down. And in some places, by double digits, by like record numbers. For example, homicides and shootings in Detroit were at a 57-year low last year. In Baltimore, violent crime reduced by 20% literally in a year. But statistics don't move beliefs, and they don't actually really work to drive policy when there is a belief that, well, you know, you might tell me the sky is blue, but if I believe it's pink, you're not going to convince me otherwise. And so that's the problem with leading with numbers, with statistics, because if people are like, you might tell me crime's going down, but I go outside and I see more disorder. And what do people think of? They see more people who are unhoused and unsheltered, in crisis. They see more trash on the streets, and that makes them feel like crime is out of control. There's all kinds of things that have nothing to do with crime. And when you were talking about violent crime or even low-level crime numbers, you are missing the indicators for people that actually makes them think sort of things are out of control, there is disorder. So you've got to start with what are our shared values, because that helps to sort of like bring people's guard down so they can have a conversation about what works and what doesn't work. Don't be afraid to call out the villain. Our opposition does it really, really well. We are the villain. Reform is the villain. Progress is the villain. Harm reduction strategies are the villain. We've got to feel comfortable saying tough on crime, punitive policies, reactive policies are the villain. And then you go to what actually works. And in fact, that's where numbers really matter. People love a story about, so this program in Baltimore, that was an after-school program, there was mental health treatment, and you got, you know, families involved. That actually helped to lead to a 30% reduction in youth violence. That's a great story. People are like, oh, I can picture that. That sounds great. So that's where data really, really matters. As you sort of think about narrative, you think about crime, and again, you shift out of the tough or soft on crime debate and move the conversation to safety and justice.
Thank you. Yeah. And thank you. Yes, laying that all out. So then bringing us around to public health. So Chrissie, you lead a coalition of health departments from the 35 largest cities across the country. And I know we learned about the power of story and language in public health through the COVID pandemic. But what are you seeing, and how is this happening in public health work? How are you seeing the use of, or the understanding of what's going on in the world and how that impacts or how that is carried by harm reduction work?
So first of all, double click on everything they said. I mean, Daliah's brought us all together, and clearly all of our messages dovetail here. So as Daliah said, I lead a coalition of health departments. And so I think a critical piece of that is the folks that I deal with every day are in government, right? They're part of the system, and they all believe in government and the system. That's why they show up every day. But how they show up and how they do their work sometimes is different, right? Because again, they're sort of part of that structure. And I think where public health has come a little bit in the crosshairs since COVID, during and since COVID, is not just around the public health piece, but this government doesn't work, government is bad, government can't solve your problems. Sure, government can't solve all your problems, but government actually shows up with a lot of solutions. And so that's really complicated that narrative, particularly in big cities where generally government is activist and really does want to try to solve these issues. So what we heard from our members was that they couldn't do the work they've been doing for years, the work that they knew could be successful because of this belief. And so we did some research, messaging research, and what we really found similarly is that people are with us. They don't see their cities as failing. They see their cities as thriving. And they had pride in their cities. And that, again, was across partisan lines. Now, there are differences, but everyone was like, no, my city, this is great. At the same time, they see all these challenges, right? 9 in 10 said that crime, overdose, and homelessness are problems in their cities. I mean, we don't have historical data, but, you know, I think for a long time, people have probably felt that way. But the important piece, or one of the important pieces, is they don't just blame that on individual choice. They understand that these are systemic factors, that as Daliah said, these issues need to be considered together and solved together. And I think that's a really important piece that, learning for us is, again, people understand it. They understand that it's bigger than what any one person chooses to do in his or her life. And so they identified the economy, mental health, and housing costs as key factors in these challenges. Importantly, they also believe we need to invest in solutions. So I want to make sure I get the number right, more than half of those we spoke to, and again, this is in our 35 cities, it's our footprint, so it is a very specific population, but more than half said their city invests too little in services and programs related to overdose and drug use, and nearly 2/3 said the same about homelessness. So they are seeing a policy gap and a resource gap, and recognizing that they want to, and I'm going to quote this, fix the underlying problems rather than just punishing people. So again, they're making that connection. And about 3/4, about 3/4 of folks across in the overdose space and the homelessness space believe that, again, fixing that underlying problem is the best approach. And about 7 in 10 believed that such an approach would just make their city a better place to live, regardless of what issue they're talking about. We started all this research to look at harm reduction, and where we landed was homelessness, mental health, crime, overdose. So I think that's an important learning, just from where we started and where we got. We did also have one question at the very end of our poll. Without saying the word harm reduction, we talked about a public health approach. And again, about 2/3 of respondents agreed that we needed this more holistic piece rather than a more punitive approach. So what we took away from that and what we did was a messaging playbook. And we said to our members, here are some ways to talk about things. We have some examples of our members taking that and using it locally. Our colleagues in Boston used it before they went to the city council, and they used it with their state legislature. So the 4 sort of key pieces of the narrative that we started to weave was an acknowledgement that the overdose crisis is real. In public health, we tend to say it's this crisis or that crisis or this emergency. And, comms people are sometimes like, could you stop with the crisis? But this is a thing that everybody knows and understands, and we need to own it. Like, we can't dismiss it, right? And really focusing on people, and that this is something that happens in people in our communities, and connection to community, not just one city, but one's community. In our focus groups, we sometimes saw a dichotomy between what folks thought was happening in their community versus their city. And this idea that we're all in it together. The last piece is really recognizing that there are short and long-term solutions. So clearly, we're not going to solve any of these crises tomorrow, but we need to do something in the short term to make people feel like, A, we're moving the needle, and B, that they, their families, their communities, their friends are making progress, and then thinking about, but long term, what do we do? So how do we tell the policy story so that we can get resources to work in all our communities?
Great, thank you. So laying out this landscape then, and returning to this specific problem or a set of social health and social problems that show up in public, and recognizing that in public policy, as I think I sort of implied, but often we carve these out and treat them separately because they are sort of happening in separate sectors or owned by separate sectors. So how do we use the reality that they are actually happening together and use narrative, whether as advocates or as policymakers or as elected officials, to really bring the solutions to these issues together to move policy forward that's actually going to address the root causes in the short term and the long term. Big question, but any of you.
I can jump in.
Yeah.
The first piece that you will see when Chrissie was speaking and when Insha was speaking, and if I tell you all about the research that the Housing Narrative Lab has done, there are extreme points of connection between all three. So even though I'm working to solve the homelessness system, and Insha's working on criminal justice, and Chrissie is working on public health, the way we talk about narrative, the role of narrative in our lives and in our work, it doesn't change. So that the pieces of, for example, people are with us. In homelessness, people are with us. They understand that homelessness is terrible, that not just for them when they're walking down the street, but for every single human who has to live outside. They get that this is a problem that we need to have a solution for. Here's where we've run into some narrative rubs, right? We've got people with us. We lose them, though, when we start talking about potential solutions, right? We get into kind of a sticky place around how to talk about solutions. We may talk about it in a way that might be a little too wonky. We may talk about it in a way that doesn't acknowledge the realities of what they see. And so we get into some of the challenges there. And so it becomes really important for first, all of us to understand how narrative works, how to start talking to folks based on their shared values, how to talk with them in ways that they're really going to understand, how to give them a really clear solution. So from my end on homelessness and housing, I talk a lot about our villain is the housing system. Our villain is that we don't have enough places that people can afford. We haven't done any kind of public investing in housing. That's the villain, right? As opposed to the narrative that many people have that's rooted in blame. We see that with housing and with homelessness as well, right? If you live on the street, it's your fault. You did something wrong. And yet, people are with us because more people are experiencing housing insecurity, or they know someone who is. More people are spending more than a third, almost half of their income on housing. More people are understanding and seeing that more people are experiencing homelessness, either they or someone they know. So there are some personal connections there where they're going to be able to start to see, right, that this isn't about personal blame or choice or any of the other really harmful narratives that are leading to these kinds of policies. But for all of us in here, it's recognizing, yes, I have a lot of individual data points around the research, as does Insha and as does Chrissie, but that how we talk about it, the shared values, naming cause and or villain, however, right, you wanna frame that, and providing people with the solution, giving them something to do, right? Any of our pieces require someone to do something. It can be as simple as, click a thing, engage, or give us, fundraise, or, any number of things, but gives them something to do, learn. And so the thing that I would say is that for all of us, understanding how each one of us can engage in narrative is important. And you do that when you understand that narrative is just essential to who we are as people. So we all engage in narrative every single day, every single time we open our mouths.
So I'll share how I am thinking about what to do next in the immediate as an advocate, and maybe there is some sort of value to folks in this room. So I, as an advocate, others in this room as an advocate, we can get the messaging perfect. We can nail it like till the cows come home, and yet we don't have the platform, I would say. Criminal justice reform field, I don't think we have the power to actually have that be enough to move the needle. And so for the past 2 years, with all of this messaging research that we've been doing, we've essentially had 4 strategies. One is to talk to candidates and electeds through our 501c4 and pick specific races in which we know crime will be the dominant issue of debate. So, you know, the LA mayoral race 2 years ago, mayoral race here in New York City. And the idea is not to be like, let's get behind one candidate or another, which is sort of the traditional way of thinking about electoral politics. But for us to literally make crime as the sort of wedge issue that it is, to take it off the table, to inoculate. And you would do that if all of the candidates actually have very similar platforms and messages on the issue, right? So that's one way, and we're sort of building over time proof points. We have a great proof point from the Wisconsin Senate race in the last election cycle of Tammy Baldwin, who, when she talked about overdose and addiction, she actually talked about her mother who struggled with addiction. She talked about things like fentanyl test strips and naloxone and community-based treatment. We actually tested it, and turns out it really resonated with people because, like I said, in Wisconsin, conservatives to progressives there all said drug overdoses are my biggest crime concern. And I think all of us in this room would say that's not a crime concern, that's a public health concern. But, you know, that's how it codes as an issue for people. So that's one part of the strategy. The other is doing a ton of media outreach to ask reporters. You know who the reporters are who are working on this beat, to sort of show them the data, to say this is actually a really effective way to talk about this issue. You care about getting this right, don't you? You care deeply about being a sort of accountable, thoughtful journalist. You appeal to people's like better angels. They are there with you. And doing that over time, and that's not going to make a change immediately, but we've watched it make a change over time, especially when we are working with local partners in the city of Detroit or in St. Louis, and we're watching that surround sound. The third is really organizing our field so we are all on message and we have message discipline. And then the fourth piece is really trying out new ways to reach people. We have, as advocates, traditionally gone to like print media and sort of what I would call, you know, old media. That's not where most people are getting their information. It's not where their perspectives are being shaped or where they're engaging in debate. We got to go online, we got to go podcast, we got to YouTube, we got to go to all of those places. And that's, again, a big lesson sort of coming out of the 2024 election cycle. But it's been fascinating to try out a social influencer program using our safety and justice narrative messaging. And it's just been unbelievably successful in having, you know, people who are otherwise putting on makeup and telling stories about whatever on the internet suddenly talk about, like, you want to talk about stop and frisk and like what that actually does to communities, and people listen. It's been amazing. So those are just 4 strategies that we have been trying out. More than happy to talk to folks one-on-one if you're curious, like how might that relate to what you're doing. But, you know, to the question of what do, we've got to do something immediately, and the problem feels so big we can't boil the ocean. These are some really concrete ways in which we're trying to put it all into action.
So I'd say much less aspirational. We also need to be okay with incremental change. And for the next couple of years, it might be not going backwards more. I know that's not inspirational, and I apologize. But as someone who works a lot with local governmental officials, it really is, what's the best good I can do today to help my community? And so I think that is part of it. You know, we're doing some similar things, and with some more funding from Vital Strategies, we're going to do some of this. But, you know, we're thinking about with journalists, like the train the trainer model, which everybody in public health loves. Like, I roll my eyes at it. Oh, we're going to train the trainer. Okay. But how do we talk with journalists about how they could better communicate with communities? And what does it mean when they use words in a story? You know, again, in the same way that many of us don't mean to offend someone, journalists don't either, right? So what does that look like? How does that show up? I talked a lot during COVID about passing the mom test. Like, is my mom going to understand this? How's my mom going to feel about that? And I think that's a good question too, because these challenges are real and hard, and people just need to understand and show up and realize what they're saying and doing may be harmful and not helpful. So I think that's part of it. And then also being ready with additional policy changes when the time comes, right? I mean, things move year to year, every 2 to 4 years, etc. So let's know what we need to do on the next best day. And I think one last thing I'll say is I think some of the challenges cutting across these issues is we are all under-resourced at the local level, the state level, the federal level, and as advocates, right? No matter what we all do, there's so much more we could do. And so we need to figure out how we can most effectively work together and pool dollars so that we are making impact across all of these issues in pursuit of any one of them.
Thank you. That's actually a very neat place to leave us, to open the floor to questions from the audience. Great. Yes. Question. We have a microphone coming, so yes.
Hi, my name is Veronica. I'm founder of the National Coalition for Drug Legalization, and we just wrapped up a study with Johns Hopkins. One of the leading researchers is here in this room, Dr. Sawa Rahani. We studied drug market violence in Baltimore and talk about government. The research is for them, to help the city and the police get a better idea of how much of the crime is coming from drugs. And the follow-on study, we want to do it with University of Maryland, but they're not paying attention. I'm very persistent, but they're not responding. So how do you get the attention of policymakers and law enforcement so that they can get more understanding about how much of the crime is coming from drugs, and then push a narrative that's different than put more police officers on the street, but actually drives a different kind of policy that's less punitive?
So I don't know that I have the answer on how you get the criminal justice system involved. I will say that one of the strengths, and I can only speak for the folks that I work with, who again are health leaders in generally the nation's largest cities, public health is so rooted in community. And I think finding that community connection and finding, that one person in the health department, frankly, or whatever department you're talking about, that is really interested in your work, that person is going to then go, to their colleague and say, hey, did you see this? And do we know anyone at the police department, or do we know anyone in the mayor's office? I mean, I will say I have a real bias for a city structure with a mayor and a mayor's cabinet, right? If one thing gets on somebody's agenda, all of a sudden that thing is going to move. And if it is something that is public and is impacting public safety, and somebody brings it to the attention of the right person at City Hall, and then there's an election, it's things that impact. I mean, I will really quickly share this story of a jurisdiction. One of our members was doing what everybody was doing during COVID. Every morning they were meeting with the mayor's cabinet, and they were figuring out what they had to do that day to save lives, to get people vaccinated, to test people. They had an aha moment at the end of the pandemic. Why aren't we doing this for other things? It seemed so obvious, but they were in response mode, and maybe that's part of it, right? Thinking in a different frame. So they were a jurisdiction that had really high homicide rates. And so the mayor said, we're going to do for community safety what we did for COVID. And they met, I don't think every day, but fairly routinely as a cabinet. Every city agency had to show up and say what they were going to do to to lower the homicide rate. And they had to put it on paper, and they were accountable to the mayor. So, things can move. I think finding the right person helps. But really thinking again across sector how that can happen can help.
Veronica, if I could offer something, I don't know what you've done already, and so maybe you've tried these things, but I do think, especially in a city like Baltimore, where there's 3 main newspapers, trying to get some stories out about this, trying to get the local news to run a piece and be what are folks doing? That kind of a thing. You'd obviously have to put a lot of trust in your reporters that they will get it right. But that to me feels yeah, great, that's awesome. And then send it around social media. Be how do we organize folks to be tweet this at the mayor, tweet this at the governor, tweet this at the again, I'm sure all stuff that you have thought about, done, but I have found the constituents are asking about this. What are we doing is, at least in my experience working with government, the most effective way to get them to pay attention. And crime is a top issue of concern in Baltimore. State legislature just, kicked off their legislative session this week, and they are thinking about public safety stuff. So I think it is an ideal time to try and push really hard on this. It's really important work you're doing.
Hi, my name is Natalia Linou. I work at the UN Development Program, but my question is around this notion of villain. And what I think many of us in this space have sort of failed to understand is that or where I think the opposition is coming is the villain is often the policeman who is my cousin or the correctional officer who is my uncle. And we don't talk about the people who work in the criminal legal system. And I think in the green kind of climate world, we've been much more successful. We don't villainize the coal worker. We talk about just transitions, about what that means. And I think we have failed to sort of, when we talk about defunding the police, to really say we're actually talking about funding public health and the inequities that we see in terms of, budgets, and really the budget needs to shift. And we don't want people to lose their jobs, but really, if you're a social worker working in a police department, which exists, you really should be working in the health department and having a different role. So I think recognizing the people who work in the criminal legal system, have a say and have families and shape the narrative is something that I know in my work in the past I've overlooked. And it's come up a lot in the context of rural communities in the US, where the sort of correctional officers are the main employer in a lot of communities of color. And so if you're not going to offer an alternative employment, you're basically saying, we want to shut down your prison and you don't have a job now. And so how do we think about that and who the villain is? I'd love your thoughts on that.
Well, Marisol, you said something I think is really right. It's like sometimes you go villain, sometimes you go cause, and there is a meaningful difference. Now, I'm curious if you want to say more about that, then I'm happy to talk about your point. So I think you are absolutely right that villainizing people is not helpful because most people take it personally, or they think about the person that they love or know who is in that role. So I think you are right about that. I do think, though, there is, at least when it comes to the criminal legal system, a deep amount of dissatisfaction with the way policing is currently done, the amount of money that is spent, and the really poor return on investment. And so when the defund attack comes, and I'm not saying at all go on the offense and talk about divest, invest kind of things, because it's actually not a very effective strategy. You want to, like, on the affirmative, take the conversation where you want to go, which is like invest in these things, right? But the defund attack comes. It comes for all of us. It has been here since 2020. It will continue to be here. And so here's what you do is, again, you call it out for the scare tactic it is. And the best line that we have tested to be able to pivot and get back on our own messaging frame is, that's a scare tactic. I'm here for real solutions that work to prevent crime, respond to crisis, and stop violence. And then you go to, we are spending $115 billion a year on police and asking them to do everything. You go to like the litany of stuff we ask police to do and put on their shoulders that they are not trained to do, they are not called upon to do it. In fact, people don't want them to do it. And then you turn to, and we need to look at more than police to produce community safety. And that gets us right back to where we want to go. But that's the bridge that we found. And again, you're not villainizing the police officer. You are talking about the problem is that we ask them to do things that they are not trained, that they are not right to do. And we just keep putting money into it. Don't you agree? It's a poor return on investment. And the other piece is, we've actually found from our research, people don't want more policing. They want better, more accountable policing. They believe there is a role for police and there is a role for many other first responders. We need to be sending the right first responders. So that's the way to have the larger conversation around that too.
What I would add to that is sort of twofold. One is every narrative needs a villain, and I'm going to use that in quotes, right? I mean, think about every story that you love or have listened to. The hero and or heroes overcome something. Sometimes it's a villain in the form of a person. Sometimes it's a system. Sometimes it's internal or external. And so any of our narratives, it is important for us to have either a villain, if you want to use the word villain, or some kind of challenge and or cause that's getting in the way of people being able to do a thing. And so, for example, in homelessness, we face a very similar challenge, which is we can't name villains like landlords or housing developers, because guess what? Those are the people that are providing the thing that we need in order to solve, right, the issue. However, we can talk about how we have created a system over the course of decades that has disinvested in housing. We don't preserve, we don't protect, we don't produce housing that people can afford. That is the thing that gets in the way. And so when you are, to Insha's point, when you are thinking about the villain, right? The villain is how policing is happening, but not who. And that's something that we all kind of need to be thinking about. But we do need to, we're working on this for a reason. There are challenges and we need to name them and name them clearly.
Thank you. Thank you. Okay, we have time for one more question, I think. Yes. Okay. Oh, please.
Hello, my name is Elle, and I want to say I'm working here, but I just started at the Drug Policy Alliance, so it's not like I've been there for a long time. We've been there for 8 days. But my question has a little to do with narrative, but it also has to do with criminalization. So oftentimes when we talk about the drug war and we talk about overdose, we talk about folks who are users, and we also have a lot of empathy and sympathy and care for folks who are drug users. But I also want to ask about narratives surrounding folks who sell drugs, because oftentimes in this narrative around public health and drug use, it is focused on the drug user, but a big like pushback I'll get is, well, what are we gonna do for people that like sell drugs, and how do we still criminalize them? How do we punish them? How do we harm them? And I guess like, how do you talk about drug selling or drug sellers under a public health vision that doesn't, because there are a lot of folks who use drugs that also sell drugs. There are a lot of folks who sell drugs as a business, as a form of like, keeping their livelihood. And so I guess like I'm looking for more information on like kind of how we frame that narrative and how we talk about that issue in a way that like still aligns with the public health vision.
So this isn't a perfect answer to your question, but I have a colleague who always talks about the policy issue of drug use as both the supply and the demand problem, right? And she always talks about that many of the policies we see at the federal level deal with the supply problem and not the demand problem, right? So this doesn't exactly go to your question, but it's both, right? We have too many people who use drugs, and we have too many drugs in the streets, whether legal, illegal, whatever. So we need to think through, how do we prevent and address both sides of those problems, right? In an ideal world, we'd have less drugs and we'd have less people who use drugs, but they're interrelated and we can't separate them. I'll let them talk more specifically about narrative and how we talk about those people in particular, but it is two sides of the same coin in some ways.
Mm-hmm. We haven't actually, our research has really been around homelessness, and we are now really digging into this piece about the intersection between homelessness, drug use, and mental health. Like those three pieces. What I will say is that there has been a discomfort in the housing and homelessness field to connect these three pieces, in large part because obviously we know that people that are experiencing homelessness, that's not the only reason why people are experiencing homelessness, which is they may have mental health issues, they're using drugs, like that's the narrative. And, right, there are also a lot of people that can't afford a place to live, don't have jobs, have health scares. We can kind of choose and go through all of the pieces, but we haven't actually yet done a lot of research that really specifically talks about that. What I will say, just from sort of messaging and communications pieces, how important it is to frame narratives about people having opportunities to live their best lives, to make the kinds of choices that keep them healthy, that keep them safe. And that includes people having to make decisions or people making decisions to sell drugs for whatever reasons. But that issue of opportunity, especially, I'm from the Bronx, and I come from an immigrant family. And you all are probably familiar with the fact that the city likes to put a lot of social services in the Bronx, right? There are a lot of Black and brown people there. And so you also have a lot of NIMBYism from Black and brown people who have really hustled to own a home. And one way that the city has been able to kind of address the NIMBYism is when they have town hall meetings where they're talking to folks about, like, if this home opens up here for, and then pick your population, it provides folks with an opportunity. Right? That really resonates with Black and brown folks and immigrant folks who understand the value of having an opportunity, the value of having a second chance. So just generally, that would be a shared value that I would say you could lean into.
All of this advice is exactly right. We've done a lot of testing on how to talk about fentanyl, the overdose crisis. We've done some on how to talk about sellers versus users, and then sort of how do we humanize everybody. We are in a particularly challenging moment around that, and folks who worked on Oregon and the rolling back of Measure 110, you all did at DPA, the ACLU, many other local organizations. There's deep compassion fatigue on this issue in a way that, at least in the sort of 3+ years that we've been doing this research, we are just finding people are like, I get that that's a problem. I get that people are struggling, and that is why they turn to selling drugs or using drugs. But I don't really care. Like, I want my city to feel safer. I don't want to step over somebody when I'm walking outside. So we are just in a very particular sort of acutely challenging moment when it comes to compassion with our messaging. That said, we did test out a message that basically breaks even with the sort of tough on crime, like throw everyone in jail sort of message. And it was essentially some version of this. It's like, we all want to live healthy, stable, successful lives. Drug overdoses are, through the roof, and everybody knows what it's like to see somebody they love struggle with addiction. Addiction has many forms, and some people are using to get by, some people are selling to get by. And we cannot arrest and incarcerate our way out of this problem. We need a new approach. And then you go to what the solutions are. So you heard values, you heard villain, and the vision is we need to stop the flow of fentanyl and drugs across the border. There's a lot of, people have a lot of feelings about that one. I'm just telling you what tested even with the, we got to shut down the border, arrest and lock up everybody. I'm just telling you that. And there are ways to do, I think, trying to address sort of like the supply. The truth is we can never actually stop the supply of fentanyl. It's so cheap and easy to make, and it's made in, labs. It's not grown like other drugs that are, organic. So, but I'm just saying, start with that. And then you talk about in communities, we need to make sure we do all the harm reduction things, more access to treatment, test strips, all of that stuff, test really well. You can leave out the part about the border and you literally lose about 12% support. So again, just telling you where we are as a country on this. I think it will change over time, but that's what we found from the research.
Can I know we're done, but there's a piece that's really important there. Some of this is not just narrative. It can be true that you want an open border and fentanyl comes over the border. So somewhere there are policy things we can do that will help everyone. And it's not always wrong and it's not always right. And people are not comfortable in the gray, but particularly in this space, it goes back to my mom test. We need to think about what's real, what's blown out of proportion, but acknowledge all the other pieces that we're not as comfortable with. We may need to do and be in some space where we're not entirely comfortable. Go on, I'm sorry.
No, thank you very much. And actually, just because I work on drugs, I have to add one more thing, which is just to say that really just in the last 4 years is the first time, to your point around supply and demand reduction, it's the first time we saw federal investments tip the scale just a little bit on the demand reduction side. So that means investing in prevention, harm reduction, treatment, care for people who are using drugs, people who might consider using drugs, people who've started using drugs a little bit, and so the point being that we have historically invested so hard in supply reduction, and supply happens because of demand as well. So we could do a lot better to invest in demand reduction in that way. Not to negate the challenges of navigating the conversation around what do we do about supply. Okay, and now I took the liberty of taking us over time, but I think we're actually over time already. But thank you everybody so much for being here. Thank you to this fantastic panel. I'm glad we did a video of this because I always want to take notes every time any one of these three women open their mouths, and there are many gems that I heard through this last hour. So thank you all for being here. Thank you so much for joining us and sharing your wisdom tonight. And we're here for discussion after. So thank you everybody for coming this evening.